During this video, we're going to be talking about caring for residents who are bedridden. Now, while definitions may vary, a bedridden resident typically includes someone who is unable to turn and reposition independently in bed, or someone who is unable to independently transfer to or from bed. This includes persons who are unable to transfer because of cognitive impairments such as dementia. There are many reasons a resident may become bedridden, including strokes, debilitating illnesses like multiple sclerosis, as well as age-related physical changes. Now, as you can imagine, caring for a bedridden resident places tremendous responsibility on the caregiver. You become responsible for monitoring their overall well-being, as well as providing a significant amount of their direct personal care. During this video, we will discuss how to prevent complications related to bedridden status, such as skin breakdown, as well as how to provide direct personal care and keep the person as comfortable as possible. Now, while the focus of this video is on caring for persons who are already bedridden, it's important in your existing residence to do all you can to prevent bedridden status from developing. You can do this by helping to maintain their overall physical well-being, encouraging mobility, and possibly through professional services such as physical therapy. You can encourage mobility by offering regular physical activity, light walks, moving to music, or even chair exercises. Additionally, if the person uses a wheelchair, a walker, or a cane, encourage them to use that ambulatory device as independently as possible, being sure that throughout all of this you are following the appropriate physician's orders. They have the risk for developing skin breakdown, or decubitus ulcers, sometimes also called pressure ulcers or bed sores. While it's beyond the scope of this video to discuss the care of skin breakdown, you must be aware of what to look for. Skin breakdown or pressure ulcers fall into 4 stages. In its earliest stage, stage 1, a pressure ulcer simply looks like a reddened area. Be sure to check bony prominences, such as their elbow, their hips, the back of the head, and their heels. Also look between skin folds, such as under their arms, in their buttocks, and between their legs. In stage 2, the pressure ulcer has started to move through the first layer of the skin, and it may begin to look like an open wound. In stage 3, the ulcer has moved through the first layers of the skin and is a defined open wound. When we get to stage 4, the wound has gone all the way through the skin and has exposed the underlying bone or muscle. It's also possible for a pressure ulcer to be covered by eschar or necrosis, a thick black outer membrane that can actually make the wound appear like it's not as bad as it really is underneath. What's critical is that you as a caregiver identify skin breakdown in that first stage, when you see the redness. When interventions start at stage 1, healing is much more likely to occur. As we get into the deeper stage 3 and stage 4 wounds, it becomes very difficult to heal the wound and can even require surgical intervention. So as soon as you see any signs of redness or other skin problems, report them to your supervisor immediately. Next, let's talk about contractures. A contracture develops when someone is immobile for long periods of time. What you'll see is a person who has their hands, their arms, or their legs tightened up in a fixed position as that muscle has become shorter and tightened. The best interventions for contractures is to prevent them. Regular range of motion, helping the person to move their hands, their arms, their legs, their feet, will prevent those muscle fibers from shortening and becoming a contracture. So keep the person mobile, keep them moving around, even when they may be bedridden. As we mentioned, you also want to watch for urinary tract infections. When a person is laying in one position for a long period of time, urine actually can sit or become static inside the bladder, increasing the risk of infection. So watch for white, cloudy urine, red streaks in the urine, if the person complains of pain when urinating, if they complain of back or flank pain, that can be a sign that the infection has moved further up into the kidneys, a very serious infection. Any of these signs would of course require medical intervention. The best way to prevent any of these complications is to keep the person moving. Don't allow them to sit or lay in one position for long periods of time. As we'll discuss later in the video, you want to follow a regular turning and repositioning schedule to keep the person shifting their weight onto different parts of their body. You want to assist them to get out of bed and rest in a chair or wheelchair as much as possible. We also mentioned that there can be psychological complications. If you can imagine being confined to your bed or chair, being dependent on other people to help you get out of bed and move around, you can imagine how that would make you feel. A bedridden resident is at high risk for depression and anxiety. Monitor for any changes in their psychological status. Do they seem more depressed or withdrawn? Are they always sad or upset? Are they nervous, pushing their call button throughout the day, asking you to come in their room with them? The best intervention here is to help the person not feel so isolated and alone. Spend time with them. Encourage visitors. Help them to get out of their room and move into other parts of your community throughout the day. Be sure they are part of your regular activity program. And if necessary, consult with their physician regarding the use of appropriate medications. There are a number of different devices that you will use when caring for a bedridden resident. Let's start by talking about the bed itself. Now, while most residents have a typical residential bed, it is very helpful with bedridden residents to have the availability of a hospital-type bed. This type of bed will allow you to raise and lower the bed itself to a more comfortable working height when you're assisting the resident. Be sure, however, if the bed does raise, that you return it to its lowest position before leaving the room. A hospital-type bed will also typically allow you to raise the head and feet independently as part of your turning and repositioning schedule. Bed rails are an important issue to consider. In many states, the use of bed rails is either prohibited or severely limited in assisted living facilities. So do not use bed rails without following your appropriate state regulations and facility policies. Bed rails can be helpful in that they allow the resident to use them when turning and repositioning. But bed rails should never be used as a restraint, as a way to force a person to stay in bed. And you should also be aware that bed rails can in fact be dangerous. A resident with cognitive impairment who attempts to climb out of a bed that has bed rails can actually become caught in the rail and hurt their arm or even cause more serious injuries. The mattress is also important. Now, while you'll want to follow physician's orders for the appropriate type of mattress, foam A crate and air mattresses are commonly recommended as they help to alleviate pressure on the skin and minimize the chance of pressure ulcers. Next is the bedding. You want it to be lightweight and comfortable. You want to make sure you don't leave a lot of heavy sheets or pillows piled up on the person's feet, causing unnecessary pressure. You also want to be careful when making the bed that the sheets are nice and flat. Any folds or creases in the bedding can create pressure points that increase the chance of skin breakdown. The physician or physical therapist may also recommend the use of various splints or booties. Sheepskin booties are often to minimize pressure or chafing on the heels for persons who are at high risk for skin breakdown. Splints on the feet, legs, hands, and arms are sometimes recommended to treat contractures. Again, be sure before using any of these devices that you have an appropriate physician's order and that you've been trained by the physical therapist in their proper use. As we've already mentioned, foam wedges can be very helpful to use when repositioning the resident. Lastly, don't forget some common items you want to have in the room. A convenient bedside table that can roll over the bed for easier use by the resident is helpful. A glass of water. any assistive devices such as eyeglasses that they may need nearby. Make sure the room is as comfortable and home-like as possible. One of the most important interventions you can take when caring for a bedridden resident is to turn and reposition them on a regular basis. While schedules may vary, every 2 hours is a common interval followed for repositioning schedules. Be sure to check with the resident's physician to see how often you should be turning and repositioning them in your facility. It's also important when you assist a resident to reposition or turn in bed that they are comfortable. Make sure that they're not laying on top of their arm or that their feet are pinched underneath one of their legs. You want the person to be in a comfortable resting position at all times. For residents that require total assistance in turning in bed, you want to use a technique sometimes referred to as the log roll. Gently take hold of the person's shoulders and hips, as this is where most of their body weight is centered. And as you assist them to turn, do it in one smooth movement so as not to twist their back or make them uncomfortable or possibly cause injury. Again, once you have them turned, make sure that they're comfortable. Replace pillows, move their hands and feet to a comfortable position. When turning them to their side, you also want to typically use something to help prop them up. You can use a pillow, or you can use a foam wedge that is designed specifically for this purpose. Make sure that they're not laying on any creases, folded up blankets, or folded over pillows that could cause unnecessary pressure on their skin, leading to possible pressure ulcer development. Bedridden residents, of course, are at a high risk for developing incontinence. Be sure to assist the resident to use the bathroom or bedside commode as much as necessary. And if the person does become incontinent, be sure to keep them clean and dry at all times, changing their bedding and briefs as necessary. It's important to follow applicable regulations regarding bedridden status. While requirements will vary from state to state, most states do have specific restrictions and guidelines that must be followed. You also need to follow the appropriate fire code. Most states require a special type of fire clearance for an assisted living facility to retain bedridden residents. While caring for bedridden residents is a challenge, it's also an opportunity for you to make a significant impact on the quality of life for the persons you're caring for. Much success to you in caring for bedridden residents.